Your cat's tail has been hanging lower than usual for 3 days. You assume she's tired or annoyed. What if that low tail is the earliest warning sign your cat can give you that something hurts? Most owners read tail language as pure emotion: happy, angry, scared. The feline tail contains 18 to 23 bones, roughly 10% of the entire skeleton, plus muscles, ligaments, and a dense network of spinal nerves. Nerve roots from the same region of the spine supply the tail and also give rise to nerves that control bladder and bowel function and contribute to hind limb coordination. Damage or pain anywhere along this structure shows up in how the tail moves or stops moving. Current veterinary pain research focuses heavily on facial expressions and whole body posture, and persistent tail changes combined with other behavioral and physical signs may help flag illness earlier and should prompt veterinary attention. This video unpacks what science actually supports about tail-based illness detection, what remains speculation, and which tail red flags demand immediate attention. Wild felids and domestic cats use their tails as dynamic counterweights during complex movement. Researchers placed cats on a narrow beam and displaced it laterally without warning. High-speed video captured the tail moving rapidly in the opposite direction of the perturbation, realigning the hips over the beam. When experimenters performed sacrocaudal spinal transection, severing supraspinal control of the tail only, the same cats fell clearly more often during beam displacement. The tail's corrective movements materially improve balance during challenging locomotion, not just communication. The caudal spinal segments give rise to paired nerves that innervate the tail, anus, and bladder simultaneously. A prospective study of 21 cats with sacrocaudal fracture subluxation, common after tail pulls or car accidents, tested whether sensation at the tail base could predict recovery of urination control. All 11 cats that retained pain sensation at the tail base regained voluntary urination within 3 days of injury. Only a minority of cats lacking tail base sensation recovered bladder control, even with supportive care. A suddenly limp, non-responsive tail after trauma is not cosmetic. It signals nerve damage with functional consequences for elimination and movement. Domestic cats descend from the African wildcat, a solitary ambush predator. Solitary hunters rely on visual signals, body posture, ear position, tail carriage, to avoid costly physical conflict. A puffed tail with arched back signals, "I am larger and dangerous," deterring rivals without fighting. A low tucked tail communicates submission or retreat, reducing aggression from dominant animals. These postures remain hardwired in domestic cats, but they now also overlap with pain and illness states. A cat feeling vulnerable due to nausea, joint pain, or respiratory distress may adopt the same defensive low tail posture it would use to signal fear to a rival. Think of the tail as a multi-purpose flag. The same lowered position can mean "I surrender" or "I hurt." Context determines which. Assessing pain in cats has historically been difficult because they hide weakness and rarely vocalize discomfort. The Feline Grimace Scale, developed and validated in 2019, uses 5 facial action units: ear position, orbital tightening, muzzle tension, whisker position, and head position. In a case control study of 35 painful cats and 20 controls, the scale showed strong correlation with existing pain measures and excellent inter-rater reliability. Tail behaviors do not appear among the core action units, reflecting current emphasis on facial and postural cues for acute pain assessment. A 2023 ethogram of acute pain behaviors in cats compiled literature-derived signs and refined them via expert review into 24 items. Categories included cage position, exploratory behavior, activity, posture, affective state, vocalization, play, feeding, and facial expression. Tail-specific behaviors were not among the final validated items with high content and face validity. A modified Delphi study of 19 veterinary experts in feline medicine sought consensus on which behavioral signs indicate pain. The panel identified 25 behaviors considered sufficient to indicate pain when present. 0 behaviors were considered necessary, meaning no single sign, including any specific tail position, must be present whenever a cat is in pain. The study concluded these signs should be interpreted in combination and in context, not as isolated diagnostic markers. Many commonly circulated diagrams mapping specific tail positions to precise health states go beyond available evidence. These may be useful prompts for owners to look more closely, but they are not diagnostic algorithms. The 2024 ISFM and AAFP Consensus Guidelines on Long-Term NSAID Use state that behavioral signs remain the best indicator of chronic pain states in cats. These signs include reduced activity, reluctance or hesitation when jumping, changes in grooming, over-grooming sore areas or neglecting grooming, altered interactions with people or other animals, and changes in posture or movement. Clinicians frequently observe that cats with chronic pain, such as osteoarthritis, carry their tails lower, move them less, and show stiffness in both spine and tail. This remains largely clinical experience rather than formally quantified research. An unusually low, stiff tail in an older cat that has also stopped jumping to favorite perches is more concerning for degenerative joint disease than the same tail position in a young cat actively stalking a toy. A limp, dragging, or non-responsive tail is strongly associated with trauma or neurologic injury. The tail's caudal vertebrae and associated nerves can be fractured or damaged by tail pulls, caught indoors, stepped on, or run over. Fractures near the base of the tail may require surgical intervention or amputation. Because the same nerve roots serve the bladder and anus, severe sacrocaudal injuries can cause urinary and fecal incontinence or loss of tail base sensation. A suddenly limp tail after trauma, particularly if accompanied by dribbling urine, inability to urinate, or fecal incontinence, is treated as an emergency until proven otherwise. Multiple veterinary client education resources note that a tail held low, tightly against the body, or wrapped around the body can signal fear, anxiety, pain, or feeling unwell. A tail tucked between the legs may indicate that the cat is really scared or experiencing pain. A cat frequently crouching with its tail curled tightly around its body for more than a few days should be evaluated by a veterinarian to rule out pain or illness. A tail held down between the legs or low to the ground, especially along with a hunched posture, may indicate pain or sickness. The same tail position can also occur in hunting or intense play, underscoring the need for context. Feline hyperesthesia syndrome is characterized by episodes of skin rippling over the dorsal lumbar area, sudden running or jumping, excessive vocalization, and intense focus on the tail and lower back. A retrospective study of 7 cats with FHS and tail mutilation found most were young, median age 1 year at onset, male, and had outdoor access. Multiple daily episodes of tail chasing and self-trauma were reported in 5 cats, with tail mutilation in 4. Extensive diagnostic workups, hematology, biochemistry, infectious disease serology, MRI, CSF analysis, electrodiagnostics failed to reveal a single underlying cause in any case. Sudden, intense, repetitive attacking of the tail, especially leading to injury, is not normal play behavior and warrants prompt veterinary and behavioral assessment. Cats evolve to mask vulnerability. By the time they show obvious distress, illness is often advanced. The tail is one piece of a larger communication system: posture, face, behavior, appetite, grooming. A low tail alone is not a diagnosis, but a low tail that persists for days, paired with hiding or reduced jumping, is your cat's way of asking for help. Learn your cat's normal tail carriage during rest, play, and interaction. Deviation from that individual baseline, especially combined with other changes, is the signal to act. Your cat's tail is not a crystal ball, but it is a window, and sometimes the earliest one you get.